Question 1. A child in your care consistently displays challenging behaviors, such as hitting and biting, particularly during transitions. You have already implemented a visual schedule and offered choices, but the behaviors persist. What is the most appropriate next step for a CDA professional to take in addressing this ongoing issue? A. Exclude the child from group activities until the behavior stops. B. Schedule a conference with the parents to share observations and collaboratively develop a consistent approach. C. Increase the use of timeout every time the child hits or bites. D. Refer the child for immediate psychological evaluation without parental input. Answer: B. Schedule a conference with the parents to share observations and collaboratively develop a consistent approach. This question assesses your understanding of collaborative problem-solving and family partnerships, which are central to effective child development practices. The keywords most appropriate next step and ongoing issue indicate a need for a deeper, comprehensive strategy rather than just an immediate reaction. When persistent challenging behaviors occur, partnering with families to share observations and create a unified strategy is crucial because consistency between home and care settings significantly supports a child's development and behavior management. For example, if you and the parents agree on using positive reinforcement for gentle hands, the child receives a clear, consistent message from all caregivers. Remember, families are a child's primary teachers, and their involvement is key to addressing complex behavioral concerns. Question 2. During a routine outdoor play session, a 4-year-old child scrapes their knee. After cleaning the wound and applying a bandage, the child becomes inconsolable and cries persistently, refusing to participate further. What is the best CDA response to support the child's emotional well-being? A. Tell the child to be brave and encourage them to rejoin play immediately. B. Allow the child to sit quietly nearby, offering comfort and reassurance until they feel ready to re-engage. C. Distract the child with a favorite toy to stop the crying quickly. D. Inform the parents that the child is overly sensitive and suggest they address it at home. Answer: B. Allow the child to sit quietly nearby, offering comfort and reassurance until they feel ready to re-engage. This question tests your ability to provide sensitive, individualized emotional support following a minor injury, emphasizing the importance of respecting a child's feelings. The keywords best CDA response and inconsolable and cries persistently highlight the child's significant distress. Providing comfort and space allows the child to process their feelings and regain composure at their own pace, fostering emotional security and resilience rather than minimizing their pain or forcing them to conform. For instance, you might say, "It's okay to feel sad about your scraped knee, I'm here if you need a hug," and then offer a quiet spot. Always remember to validate a child's emotions, as it builds trust and teaches them healthy coping strategies. Question 3. You are preparing to introduce a new art activity involving finger painting. One child in your group has a known severe allergy to latex, which is often found in common gloves and some art supplies. What is the most critical proactive measure you must take before starting the activity? A. Ensure all children wear aprons to protect their clothes. B. Have a first aid kit readily available for any minor cuts. C. Confirm that all art supplies, including paint and gloves, are latex-free and clearly labeled. D. Provide separate, non-allergenic paint for the child with the allergy. Answer: C. Confirm that all art supplies, including paint and gloves, are latex-free and clearly labeled. This question focuses on vital health and safety protocols, specifically managing allergies in a childcare setting. The keywords severe allergy to latex and most critical proactive measure emphasize the necessity of preventing exposure rather than just reacting to an incident. Ensuring all materials are latex-free, not just for the affected child but for the entire group if cross-contamination is a risk, prevents a potentially life-threatening allergic reaction. For example, checking the ingredient list on all paints and confirming that any gloves used by staff or children are vinyl or nitrile is essential. Your absolute priority in childcare is always the safety of every child, especially those with severe allergies. Question 4. A new family is enrolling their child who has limited English proficiency. The parents primarily speak Spanish, and you only speak English. What is the most effective strategy for building a productive relationship and ensuring clear communication with this family? A. Rely on the child to translate information between you and the parents. B. Provide all important documents in English and expect the parents to find their own translator. C. Utilize a professional interpreter or seek out bilingual staff/resources to facilitate communication during key interactions. D. Communicate solely through brief notes sent home, hoping the parents understand. Answer: C. Utilize a professional interpreter or seek out bilingual staff/resources to facilitate communication during key interactions. This question addresses the CDA competency of building productive relationships with families, particularly those from diverse linguistic backgrounds. The keywords limited English proficiency and most effective strategy highlight the need for intentional, respectful, and accurate communication. Using a professional interpreter or bilingual resources ensures that critical information, such as health forms, policies, and developmental progress, is accurately conveyed and understood, fostering trust and true partnership. For instance, during an initial enrollment meeting or a parent-teacher conference, having an interpreter present ensures both parties can express themselves fully. Always strive to bridge communication gaps thoughtfully to create an inclusive environment for all families. Question 5. You observe a 2-year-old child repeatedly attempting to stack large blocks, but they frequently tumble down, causing the child to become visibly frustrated and give up. What is the most appropriate way for a CDA professional to support this child's intellectual development? A. Stack the blocks for the child to show them how it's done perfectly. B. Put the blocks away and suggest a different, easier activity. C. Offer a small amount of support, such as stabilizing the base block, and provide encouragement, "You're trying so hard." D. Tell the child to keep trying until they succeed independently. Answer: C. Offer a small amount of support, such as stabilizing the base block, and provide encouragement, "You're trying so hard." This question tests your knowledge of scaffolding, a key concept in supporting intellectual development within a child's zone of proximal development. The keywords repeatedly attempting, visibly frustrated, and most appropriate way point to the need for guided assistance, not complete intervention or abandonment. Offering just enough support, like stabilizing a base block, helps the child overcome a temporary hurdle and experience success, while encouragement validates their effort and builds persistence. For example, you might say, "Let's hold this one steady, and you can put the next one on top." This approach helps children learn new skills independently without being overwhelmed. Remember, effective scaffolding allows children to achieve what they couldn't quite do on their own, fostering competence and confidence. Question 6. A parent frequently arrives late to pick up their child, often without prior notification. This causes disruption to closing procedures and staff schedules. What is the most professional and effective way to address this recurring issue? A. Charge the parent a late fee immediately without discussion. B. Inform other parents about the issue to gain their support in addressing it. C. Schedule a private conversation with the parent to reiterate pickup policies, understand their challenges, and discuss potential solutions. D. Tell the child that their parent is late and that they need to remind them to be on time. Answer: C. Schedule a private conversation with the parent to reiterate pickup policies, understand their challenges, and discuss potential solutions. This question assesses your professionalism and ability to handle difficult parent interactions respectfully and constructively. The keywords most professional and effective and recurring issue emphasize the need for a formal, proactive, and problem-solving approach. A private conversation allows for a clear explanation of policies, an opportunity to listen to the parent's perspective, and collaborative problem-solving, which maintains a positive relationship while addressing the concern. For example, you might say, "I've noticed recent challenges with pickup times, and I wanted to check in to see if everything is all right and discuss how we can work together." Always prioritize open communication and problem-solving over punitive or public measures when addressing parent-related issues. Question 7. According to Head Start program performance standards, what is a primary purpose of conducting ongoing child assessments? A. To label children with developmental delays for special education placement. B. To determine staff bonuses based on child performance improvements. C. To inform individualized curriculum planning and identify children who may need additional support. D. To rank children's abilities against national averages for public reporting. Answer: C. To inform individualized curriculum planning and identify children who may need additional support. This question tests your understanding of the ethical and practical purposes of child assessment in early childhood education, particularly within regulated frameworks like Head Start. The keyword primary purpose directs you to the most fundamental and beneficial reason for assessment. Ongoing assessments are designed to provide valuable insights into each child's unique development, allowing educators to tailor activities to individual needs, challenge children appropriately, and identify areas where extra support or intervention might be beneficial. For example, observing a child struggling with fine motor skills might lead you to incorporate more puzzles or drawing activities into their daily routine. Remember, assessments are tools for teaching and supporting children, not for labeling or comparing them. Question 8. A 3-year-old child consistently refuses to eat vegetables at mealtime, even when encouraged. The child eats other parts of the meal without issue. What is the most developmentally appropriate strategy for a CDA to use in this situation? A. Force the child to eat a certain amount of vegetables before they can have anything else. B. Offer a small, no-pressure portion of vegetables and allow the child to explore them without coercion. C. Remove the vegetables entirely from the child's plate to avoid a power struggle. D. Offer dessert as a reward if the child eats all their vegetables. Answer: B. Offer a small, no-pressure portion of vegetables and allow the child to explore them without coercion. This question assesses your understanding of developmentally appropriate practices related to mealtimes and picky eating. The keywords consistently refuses and most developmentally appropriate strategy highlight the need for a supportive, child-centered approach. Offering a small, no-pressure portion respects a child's autonomy and natural developmental stage regarding food preferences, encouraging self-regulation and positive associations with new foods without creating a battle. For example, you might say, "Here are some carrots if you'd like to try them," placing them on the plate without further comment. Forcing children to eat can create negative associations with food, so patience and repeated, pressure-free exposure are key. Question 9. You are planning an outdoor gross motor activity for a group of toddlers. The playground has a paved area, a grassy section, and a sandbox. What is the most crucial consideration for ensuring a safe environment during this activity? A. Ensuring all children have matching outdoor shoes. B. Limiting the number of children participating at one time. C. Conducting a thorough safety check of all equipment and surfaces immediately before use. D. having a specific person designated to push children on swings. Answer: C. Conducting a thorough safety check of all equipment and surfaces immediately before use. This question directly relates to maintaining a safe learning environment, a core CDA competency. The keywords most crucial consideration and safe environment emphasize the preventative measures necessary before children enter a play space. A thorough safety check for hazards like broken equipment, sharp objects, or uneven surfaces directly prevents injuries, making it the most fundamental safety practice. For example, before letting children play, you would walk the area, looking for loose bolts on a slide or broken glass in the sandbox. Remember, proactive safety checks are always the first line of defense in preventing accidents and ensuring children can play freely and safely. Question 10. A family in your program reports that they are experiencing homelessness and have recently moved into a temporary shelter. What is the most appropriate action for a CDA professional to take to support this family? A. Advise them that you cannot continue to enroll their child due to unstable housing. B. Discreetly share their situation with other staff members to gather opinions. C. Connect the family with community resources that offer support for housing, food, and other essential needs, while maintaining confidentiality. D. Offer to let the child stay overnight at the center occasionally to provide relief to the parents. Answer: C. Connect the family with community resources that offer support for housing, food, and other essential needs, while maintaining confidentiality. This question tests your ability to support families facing significant challenges, demonstrating professionalism, empathy, and knowledge of community resources. The keywords experiencing homelessness and most appropriate action indicate a need for practical, respectful, and confidential assistance. Connecting families with relevant community resources empowers them to access necessary support while respecting their privacy and dignity, aligning with the CDA's commitment to supporting the whole family. For example, you might provide brochures for local food banks, housing assistance programs, or family support services. Remember, your role is to be a bridge to resources, not to solve their entire problem, always prioritizing their privacy and needs. Question 11. You are leading a small group of 4-year-olds in an activity focused on identifying shapes. One child frequently calls out incorrect answers and appears disengaged. What is the most effective strategy to re-engage this child and support their learning? A. Move on to a different activity to avoid frustrating the child. B. Ignore the incorrect answers and focus only on children who respond correctly. C. Provide individualized attention, offering gentle prompts or rephrasing questions, and use materials the child shows interest in. D. Tell the child that they need to pay more attention to the lesson. Answer: C. Provide individualized attention, offering gentle prompts or rephrasing questions, and use materials the child shows interest in. This question addresses individualized instruction and differentiation, key aspects of advancing intellectual competence. The keywords frequently calls out incorrect answers, disengaged, and most effective strategy highlight the need for a tailored approach to meet the child where they are. Providing individualized support, such as guiding questions or connecting to their interests, helps the child feel successful, regain confidence, and re-engage with the learning material. For example, if the child loves cars, you might ask, "Can you find a wheel that is a circle?" This approach makes learning relevant and accessible. Always remember that children learn in different ways and at different paces, so adapting your teaching is crucial. Question 12. A new childcare regulation mandates that all staff complete 10 hours of professional development annually. As a CDA professional, what is the most significant benefit of adhering to this regulation? A. It ensures you receive a pay raise at the end of the year. B. It guarantees that parents will enroll more children in your program. C. It enhances your skills and knowledge, directly improving the quality of care and education provided to children. D. It primarily benefits the childcare center by maintaining its license. Answer: C. It enhances your skills and knowledge, directly improving the quality of care and education provided to children. This question focuses on the importance of ongoing professional development and its direct impact on quality care. The keywords "most significant benefit" and "adhering to this regulation" point to the core purpose of such requirements. Professional development, regardless of specific regulations, is primarily about continuous learning and refining your practices, which directly translates into better teaching strategies, improved child outcomes, and a higher quality of care and education for the children you serve. For example, a workshop on positive behavior guidance provides new tools to support children's social-emotional growth. Always view professional development as an opportunity to grow and elevate the experiences of the children in your care. Question 13. You are preparing a sensory bin activity for a mixed age group of toddlers and preschoolers. To ensure developmental appropriateness and safety for all children, what is the most important consideration when selecting materials for the bin? A. Only include items that are bright and colorful to attract attention. B. Choose materials that are exclusively natural and biodegradable. C. Select materials that are large enough to prevent choking hazards for the youngest children, yet engaging for older ones. D. Fill the bin with only one type of material to simplify the experience. Answer: C. Select materials that are large enough to prevent choking hazards for the youngest children, yet engaging for older ones. This question addresses safety and developmental appropriateness in activity planning, especially for mixed age groups. The keywords "most important consideration," "sensory bin activity," and "mixed age group" highlight the critical balance between engagement and safety. Choking hazards are a significant risk for toddlers, so ensuring all materials are too large to be swallowed is paramount, while still providing varied textures and items that appeal to older preschoolers. For example, using large pom-poms, scarves, or dry pasta shapes instead of small beads or beans makes the bin safe for everyone. When planning activities, always prioritize safety first, then consider engagement and learning opportunities. Question 14. A parent expresses concerns that their 3-year-old child, who has been in your program for 6 months, still cries intensely every morning during drop-off and clings to them, making separation difficult. What is the most reassuring and professional response from a CDA? A. Don't worry, all children go through this, they'll get over it eventually. B. Perhaps you should leave without saying goodbye, it makes it easier. C. Let's observe together for a few days, and I can share some strategies we use to help children transition, like a special goodbye routine. D. Your child is just being manipulative, you need to be firmer. Answer: C. Let's observe together for a few days, and I can share some strategies we use to help children transition, like a special goodbye routine. This question tests your ability to build productive relationships with families and offer supportive solutions to common developmental challenges. The keywords "cries intensely every morning," "making separation difficult," and "most reassuring and professional response" indicate a need for empathy, collaboration, and practical advice. Offering to observe together and share strategies demonstrates a partnership approach, validates the parent's concern, and provides actionable steps that can foster a smoother transition for the child. For example, suggesting a consistent ritual like a quick hug and a wave from the window can make goodbyes less stressful. Always remember to approach parent concerns with understanding and a willingness to collaborate on solutions. Question 15. You are implementing a new healthy eating curriculum. One of the goals is to encourage children to try new fruits and vegetables. Which strategy aligns best with promoting positive eating habits in young children? A. Requiring children to try at least one bite of every new food. B. Using a no thank you bite rule, where children must try one small bite before refusing. C. Offering a variety of new foods alongside familiar favorites, allowing children to choose without pressure. D. Praising children excessively or offering non-food rewards for trying new foods. Answer: C. Offering a variety of new foods alongside familiar favorites, allowing children to choose without pressure. This question focuses on developmentally appropriate practices for promoting healthy eating. The keywords "aligns best with promoting positive eating habits" suggest an approach that respects children's autonomy and natural development. Offering new foods without pressure allows children to explore and become comfortable with unfamiliar items at their own pace, fostering a positive relationship with food rather than creating power struggles or associating food with rewards. For instance, putting a small bowl of sliced bell peppers next to familiar apple slices encourages curiosity without obligation. Remember, repeated, positive, and pressure-free exposure is key to expanding a child's food preferences over time. Question 16. A 5-year-old child in your care has a severe nut allergy and carries an EpiPen. The center policy states that all staff must be trained annually on EpiPen administration. You are a new staff member and have not yet received this training. What is your immediate and most responsible course of action? A. Observe another staff member administering the EpiPen during a drill. B. Read the EpiPen instructions independently to familiarize yourself with them. C. Inform your supervisor immediately that you require the mandated EpiPen administration training before being solely responsible for the child. D. Assume you can handle it if an emergency arises, as you have general first aid knowledge. Answer: C. Inform your supervisor immediately that you require the mandated EpiPen administration training before being solely responsible for the child. This question tests your commitment to professional responsibility and child safety regarding life-threatening medical conditions. The keywords severe nut allergy, EpiPen, and not yet received this training highlight a critical gap in your competence for a specific safety procedure. Your most responsible action is to immediately communicate your training needs to your supervisor, ensuring you are fully prepared to act in an emergency and that the child's safety is never compromised. For example, you would tell your supervisor, "I noticed we have a child with an EpiPen, and I haven't completed that specific training yet. When can I schedule it?" Always ensure you are fully trained and competent for all emergency medical procedures before assuming responsibility. Question 17. You notice that a 4-year-old child frequently disrupts group time by talking out of turn, wandering, and poking other children. After several gentle redirects, the behavior continues. What is the most effective proactive strategy to support this child's social-emotional development during group time? A. Remove the child from group time immediately and place them in a quiet corner. B. Ignore the child's behavior completely, hoping they will eventually conform. C. Provide the child with a specific, engaging role or a fidget toy, and offer positive reinforcement for participation and focus. D. Tell the child, "If you can't behave, you can't be part of our group." Answer: C. Provide the child with a specific, engaging role or a fidget toy, and offer positive reinforcement for participation and focus. This question addresses proactive behavior management and supporting social-emotional development during group activities. The keywords frequently disrupts, continues, and most effective proactive strategy suggest a need for preventative measures and positive support. Providing a specific role, like holding a storybook, or a sensory tool helps channel a child's energy constructively, while positive reinforcement acknowledges their efforts to engage appropriately. For example, you might ask them to be the picture helper or give them a soft stress ball to hold quietly. This approach helps children learn self-regulation and positive participation, setting them up for success. Question 18. When communicating with parents about a child's challenging behavior, what is the most appropriate initial approach for a CDA professional? A. Start by listing all the negative behaviors the child has exhibited that day. B. Focus on describing the specific behavior objectively and its impact, then share what strategies you are using. C. Blame the child's behavior on the parent's discipline methods at home. D. Minimize the behavior, saying, "It's nothing, just a phase." Answer: B. Focus on describing the specific behavior objectively and its impact, then share what strategies you are using. This question tests your ability to communicate effectively and professionally with families about challenging behaviors. The keywords "most appropriate initial approach" emphasize the need for a constructive and non-judgmental start. Describing the behavior objectively, explaining its impact, and sharing your strategies shows professionalism, partnership, and a proactive stance, inviting collaboration rather than defensiveness from parents. For example, instead of "your child was so bad today," say, "During block time, I noticed, child's name, pushed a friend to get a toy, and we worked on using our words instead." This approach fosters trust and opens the door for a collaborative solution. Question 19. A 2-year-old child frequently uses babbling and gestures to communicate, but rarely uses single words to express needs or desires, unlike peers their age. What is the most appropriate action for a CDA professional to take? A. Tell the parents that the child is probably just lazy and will talk when ready. B. Continue to observe the child's communication attempts and discuss your observations discreetly with the program director or lead teacher. C. Immediately recommend that the child undergo speech therapy without further observation. D. Focus solely on teaching the child more complex vocabulary through flashcards. Answer: B. Continue to observe the child's communication attempts and discuss your observations discreetly with the program director or lead teacher. This question assesses your role in observing and identifying potential developmental concerns, specifically in language. The keywords "rarely uses single words" and "most appropriate action" indicate a need for careful observation and professional consultation, not immediate diagnosis or intervention. Continuing to observe and then discussing concerns with a supervisor or lead teacher is crucial for validating observations, determining next steps, and initiating appropriate screening or support if needed, while respecting professional boundaries. For example, you might document specific instances where the child struggled to communicate a need. Remember, early intervention is most effective, but it starts with careful observation and collaborative professional discussion. Question 20. Your childcare center is implementing a new policy requiring parent signatures daily for drop-off and pick-up. A parent expresses frustration, stating it's an unnecessary hassle and slows down their busy mornings. What is the most effective and professional way to address their concern? A. Tell them the policy is non-negotiable and they must comply. B. Explain the safety and accountability reasons behind the policy, and offer suggestions to make the process smoother. C. Suggest they find another childcare center if they are unhappy with the policies. D. Ignore their complaint, assuming they will eventually get used to it. Answer: B. Explain the safety and accountability reasons behind the policy, and offer suggestions to make the process smoother. This question tests your ability to communicate center policies effectively and professionally while addressing parent concerns. The keywords unnecessary hassle, frustration, and most effective and professional way indicate a need for empathy, explanation, and problem solving. Explaining the rationale, safety, accountability, helps parents understand the policy's importance, and offering solutions shows your willingness to collaborate, fostering a positive relationship. For example, you might say, "I understand it adds a moment to your morning, but this signature ensures we always know exactly who is in our care and when, which is vital for safety. Perhaps signing while your child takes off their coat could save time." Always explain the why behind policies to gain parent cooperation and understanding. Question 21. A new 4-year-old child in your classroom appears withdrawn, avoids eye contact, and consistently plays alone, even when invited to join group activities. What is the most developmentally appropriate approach to support this child's social development? A. Force the child to join group activities to help them socialize. B. Immediately label the child as shy to the parents and other staff. C. Provide gentle encouragement for interaction, create opportunities for parallel play, and model social behaviors without pressure. D. Isolate the child further by providing them with independent activities only. Answer: C. Provide gentle encouragement for interaction, create opportunities for parallel play, and model social behaviors without pressure. This question addresses supporting social-emotional development, particularly for a child who is withdrawn. The keywords appears withdrawn, avoids eye contact, and most developmentally appropriate approach highlight the need for sensitive, gradual integration rather than forced interaction. Gentle encouragement, opportunities for parallel play, playing alongside others without direct interaction, and modeling provide a low-pressure environment for the child to gradually feel comfortable enough to engage socially. For example, you might sit near the child with another child and calmly narrate your play, or invite them to join a small, quiet activity like building blocks next to a pier. Remember, social development unfolds at different paces, and creating a secure environment is key to fostering comfort and participation. Question 22. Your program uses a system of individual cubbies for children's belongings. You notice that one child's cubby is consistently overflowing with personal items, making it difficult for the child to access their coat and backpack. What is the most appropriate action for a CDA professional to take? A. Clear out the cubby yourself and discard any excess items. B. Inform the child that they need to remove items from their cubby or they will be put away. C. Communicate privately with the parents about the overflowing cubby and collaborate on a solution. D. Assign the child a larger cubby to accommodate all their belongings. Answer: C. Communicate privately with the parents about the overflowing cubby and collaborate on a solution. This question tests your professionalism in managing program operations and collaborating with families on routine matters. The keywords consistently overflowing, difficult for the child to access, and most appropriate action indicate a need for communication and partnership. Communicating privately with parents respects their privacy and allows for a collaborative solution to help the child learn organization and for the space to be functional for everyone. For example, you might gently say, "I've noticed, child's name's cubby is quite full, which makes it tricky for them to find their coat. Could we work together to find a way to manage their belongings here?" Always approach parent communication with respect and a problem-solving mindset. Question 23. You are planning a science activity involving observing insects outdoors. Before taking the children outside, what is the most important step related to health and safety? A. Ensure all children wear long sleeves and pants to prevent insect bites. B. Remind children not to touch any insects they find. C. Check for known hazards in the outdoor area, such as poisonous plants, stinging insect nests, or sharp objects. D. Have children wash their hands with sanitizer before going outside. Answer C. Check for known hazards in the outdoor area, such as poisonous plants, stinging insect nests, or sharp objects. This question assesses your vigilance in maintaining a safe outdoor learning environment. The keywords most important step and health and safety emphasize proactive hazard identification. Before any outdoor activity, thoroughly checking the area for potential dangers like poisonous plants, e.g., poison ivy, insect nests, e.g., wasp nests, or discarded items is crucial to prevent immediate harm and ensure a safe space for exploration. For example, you would walk the path and the activity area, scanning for any red flags. Prioritizing a comprehensive hazard check significantly reduces risks and ensures children can explore safely. Question 24. A parent requests that their child, who is 4 years old, be taught to read and write formal letters while in your preschool program, stating that it's never too early. What is the most appropriate CDA response based on developmental principles? A. Agree to their request, as it shows the parent is highly engaged. B. Explain that while early literacy is important, the program focuses on emergent literacy skills through play and hands-on activities, which build a strong foundation for reading and writing. C. Tell the parent that 4-year-olds are not capable of learning formal reading and writing. D. Provide them with worksheets to complete at home to meet their request. Answer B. Explain that while early literacy is important, the program focuses on emergent literacy skills through play and hands-on activities, which build a strong foundation for reading and writing. This question tests your understanding of developmentally appropriate practices, DAP, in early literacy. The keywords 4 years old, taught to read and write formal letters, and most appropriate CDA response based on developmental principles highlight the need to align educational approaches with a child's natural learning stage. Explaining the emergent literacy approach respects the parent's desire for learning while clearly communicating how the program fosters foundational skills, like phonological awareness, print concepts, and fine motor skills, through play, which is more effective and appropriate for this age. For example, you might describe how children develop pre-reading skills by listening to stories, singing alphabet songs, or drawing and dictating their own stories. Emphasize that play is powerful learning. Question 25. You are updating your emergency preparedness plan. What is the most critical piece of information that must be readily accessible to all staff members in the event of an emergency evacuation? A. A list of favorite snacks for each child. B. The personal cell phone numbers of all staff members. C. A current, accurate roster of all children present, including emergency contact information and any critical medical needs. D. A detailed inventory of classroom supplies. Answer C. A current, accurate roster of all children present, including emergency contact information and any critical medical needs. This question assesses your knowledge of essential emergency preparedness, a vital aspect of child safety. The keywords most critical piece of information and emergency evacuation emphasize the paramount need for accountability and immediate care during a crisis. A comprehensive and up-to-date child roster ensures that every child is accounted for during an evacuation and that critical medical information, like allergies or medications, is available for first responders, directly safeguarding children's lives. For example, in a fire drill, you would grab this roster to check off each child as they exit the building. Always ensure this vital information is easily accessible to whoever is leading the evacuation. Question 26. A child in your care, who is usually very talkative, has become unusually quiet and withdrawn over the past week, often refusing to participate in activities and showing signs of fatigue. The parents report no changes at home. What is the most responsible initial action for a CDA professional? A. Assume the child is just having an off week and wait for the behavior to pass. B. ask the child directly why they are acting differently, without involving parents. C. Document specific observations of the child's behavior and communicate concerns privately with the parents to gather more information and discuss potential next steps. D. Immediately call Child Protective Services, CPS, based on the change in behavior. Answer: C. Document specific observations of the child's behavior and communicate concerns privately with the parents to gather more information and discuss potential next steps. This question tests your observation skills, professional communication with families, and understanding of when to seek further information regarding a child's well-being. The keywords unusually quiet and withdrawn, signs of fatigue, and most responsible initial action indicate a need for careful, documented observation and respectful parent collaboration. Openly communicating your specific, objective observations to parents allows them to share insights, collaborate on understanding the cause, and jointly decide if further action or support is needed. For instance, you might say, "I've noticed, child's name, has been much quieter and more tired this week. Have you observed anything similar at home?" Always prioritize communication with families when a child's behavior significantly changes. Question 27. When planning a culturally responsive curriculum, what is the most crucial consideration for a CDA professional? A. Focusing solely on the dominant culture of the local community. B. Including elements from diverse cultures in a superficial way, such as celebrating holidays only. C. Integrating the diverse cultural backgrounds, languages, and family structures of the children in your care into daily activities and learning materials. D. Asking parents to teach their culture's specific skills to the children. Answer: C. Integrating the diverse cultural backgrounds, languages, and family structures of the children in your care into daily activities and learning materials. This question addresses the important concept of cultural responsiveness in curriculum planning, a key aspect of supporting social and emotional development. The keyword "most crucial consideration" highlights the depth required beyond superficial inclusion. A truly culturally responsive curriculum authentically weaves children's diverse backgrounds into the daily learning environment, making learning relevant and validating each child's identity and experiences. For example, this could mean having books in multiple languages, including diverse family photos in the dramatic play area, or adapting recipes to reflect cultural foods children eat at home. Remember, children thrive when their unique cultural identities are seen, valued, and integrated into their learning environment. Question 28. During a parent-teacher conference, a parent becomes very upset and raises their voice, accusing you of not giving their child enough attention. What is the most appropriate way for a CDA professional to respond? A. Raise your voice back to show you are serious and demand respect. B. Defend yourself immediately by listing all the attention you give the child. C. Remain calm, acknowledge the parent's feelings, and ask clarifying questions to understand their specific concerns. D. End the conference immediately and reschedule when the parent is calmer. Answer: C. Remain calm, acknowledge the parent's feelings, and ask clarifying questions to understand their specific concerns. This question assesses your professionalism and conflict resolution skills when communicating with families, especially during challenging interactions. The keywords "very upset," "raises their voice," and "most appropriate way to respond" emphasize the need for de-escalation and understanding. Remaining calm and acknowledging the parent's emotions helps de-escalate the situation, while asking clarifying questions demonstrates a willingness to listen and understand their perspective, fostering a more productive dialogue. For example, you might say, "I hear you're feeling frustrated, and I want to understand what specific situations are making you feel this way." Prioritizing calm, empathetic listening is key to resolving conflicts and maintaining positive family relationships. Question 29. A 3-year-old child frequently engages in solitary play during free choice time, preferring to manipulate objects independently rather than interacting with peers. While this is developmentally normal, you want to gently encourage more social interaction. What is the most effective and developmentally appropriate strategy? A. Force the child to join a small group activity with other children. B. Arrange the environment to encourage proximity and shared use of materials, and provide open-ended materials that can be used by multiple children. C. Provide only toys that require cooperative play, such as board games. D. Tell the child that they need to play with friends. Answer: B. Arrange the environment to encourage proximity and shared use of materials, and provide open-ended materials that can be used by multiple children. This question tests your understanding of how the physical environment can support social-emotional development, especially for children who prefer solitary play. The keywords frequently engages in solitary play, gently encourage more social interaction, and most effective and developmentally appropriate strategy suggest a subtle, non-coercive approach. Arranging the environment with enticing, open-ended materials in shared spaces, like a large block area or a sensory table, naturally encourages children to play near each other, leading to opportunities for parallel or eventually associative play without pressure. For instance, putting 2 easels next to each other with shared paints can invite 2 children to draw side by side. Remember, the environment is a powerful tool for subtly guiding children's social interactions. Question 30. Your program receives a new set of outdoor play equipment. Before children are allowed to use it, what is the most critical step a CDA professional must take to ensure safety? A. Read the manufacturer's instructions for assembly and safety guidelines thoroughly. B. Allow children to explore it first to see how they naturally interact with it. C. Paint the equipment in bright colors to make it more appealing. D. Only allow older children to use it first to test its durability. Answer: A. Read the manufacturer's instructions for assembly and safety guidelines thoroughly. This question emphasizes the importance of following manufacturer guidelines for safety in a childcare setting. The keywords new set of outdoor play equipment and most critical step to ensure safety point to the foundational knowledge required for safe installation and use. Manufacturer instructions contain vital information regarding proper assembly, weight limits, age appropriateness, and required safety surfacing, which are non-negotiable for preventing injuries. For example, failing to properly anchor a slide or swings could lead to serious accidents. Always prioritize understanding and implementing manufacturer safety specifications for all equipment in your care environment. Question 31. You are planning a series of activities to support children's emergent writing skills. Which approach is most developmentally appropriate for a group of 3-year-olds? A. Providing worksheets with lines for tracing letters and words. B. Encouraging children to dictate stories for you to write, and providing various writing tools and paper for their own scribble writing and drawing. C. Focusing exclusively on proper pencil grip and letter formation. D. Requiring children to write their full names independently at every opportunity. Answer: B. Encouraging children to dictate stories for you to write, and providing various writing tools and paper for their own scribble writing and drawing. This question tests your understanding of emergent literacy and developmentally appropriate practices for early writing. The keywords emergent writing skills, 3-year-olds, and most developmentally appropriate highlight the process of early writing development. Encouraging children to dictate stories validates their ideas and connects spoken language to written text, while providing various tools for their own marks, scribbles, lines, pictures, fosters their early attempts at conveying meaning through print, which is how young children begin to write. For example, after a trip to the park, you might say, "Tell me about the swings, and I'll write it down for you." This approach builds a foundation of interest and purpose in writing. Question 32. A child in your program has special needs, and their Individualized Education Program, IEP, specifies that they require assistive technology for communication. What is your primary responsibility as a CDA professional regarding this child's IEP? A. To create a new, simplified IEP for the child that is easier to follow in the classroom. B. To ensure that the child's assistive technology is available, maintained, and integrated into daily routines as specified in the IEP. C. To teach the child's parents how to use the assistive technology at home. D. To disregard the IEP if you feel it's too disruptive to the classroom flow. Answer: B. To ensure that the child's assistive technology is available, maintained, and integrated into daily routines as specified in the IEP. This question addresses the CDA's role in supporting children with special needs and implementing individualized plans. The keywords special needs, IEP specifies, and primary responsibility emphasize the non-negotiable nature of following the formal plan. Your role is to actively facilitate the accommodations and supports outlined in the IEP, ensuring the child has access to the tools they need to communicate and participate fully in the program. For example, if an IEP states a child uses a picture communication board, you must ensure it is readily accessible and used consistently throughout the day. Adhering to the IEP is crucial for supporting the child's development and ensuring equitable access to education. Question 33. You are planning to introduce a new, open-ended art material, such as clay, to a group of 4-year-olds. What is the most effective way to foster creativity and exploration with this new material? A. Provide step-by-step instructions for a specific clay sculpture and expect children to replicate it. B. Offer the clay with minimal instructions, allowing children to freely explore its properties and create whatever they imagine. C. Show examples of finished clay art from professional artists for children to copy. D. Limit the amount of clay each child receives to prevent mess and waste. Answer: B. Offer the clay with minimal instructions, allowing children to freely explore its properties and create whatever they imagine. This question assesses your understanding of open-ended materials and fostering creativity in early childhood art. The keywords open-ended art material, foster creativity and exploration, and most effective way point to an approach that prioritizes process over product. Providing clay with minimal instruction encourages children to experiment, manipulate, and discover its properties independently, which is crucial for developing problem-solving skills, imagination, and self-expression. For example, you might simply say, "Here's some clay, let's see what you can create with it." This approach allows children to be the architects of their own learning and artistic expression. Question 34. A child frequently comes to the program appearing unkempt, with dirty clothes and poor hygiene. You have also noticed the child seems unusually hungry and tries to hoard snacks. The parents are generally uncommunicative. What is the most ethical and responsible action for a CDA professional to take? A. Send a note home to the parents requesting they improve the child's hygiene and provide more food. B. Ignore the situation, as it is a private family matter. C. Document specific observations and discreetly discuss your concerns with your supervisor to determine if a report to Child Protective Services, CPS, is warranted. D. Pack extra food for the child to take home without telling the parents. Answer C. Document specific observations and discreetly discuss your concerns with your supervisor to determine if a report to Child Protective Services, CPS, is warranted. This question addresses your responsibility as a mandated reporter and professional ethics when observing potential signs of neglect. The keywords unkempt, dirty clothes, poor hygiene, unusually hungry, hoard snacks, and uncommunicative parents are significant red flags that suggest possible neglect. Your most ethical and responsible action is to document objective observations and then consult with your supervisor, as they can help determine if the indicators meet the threshold for a formal report to Child Protective Services, CPS, which is a legal obligation for childcare professionals. For example, you would note dates and times of observations like child arrived in same clothes for 3 days, ate 3 servings of breakfast and asked for more. Your role is to protect children, and reporting concerns to the proper authorities is a critical step when neglect is suspected. Question 35. You are planning a transition from outdoor play to indoor quiet time. Many children struggle with this transition, leading to resistance and meltdowns. What is the most effective strategy to ensure a smoother transition for the group? A. Abruptly announce it's time to go inside and expect immediate compliance. B. Use a consistent verbal warning, a visual timer, and a specific transition song or chant. C. Allow children to come inside whenever they feel ready. D. Offer a special treat to children who come inside quickly. Answer B. Use a consistent verbal warning, a visual timer, and a specific transition song or chant. This question tests your ability to manage effective program operations and support children's emotional regulation during transitions. The keywords struggle with this transition, resistance and meltdowns, and most effective strategy indicate a need for predictability and clear cues. Consistent verbal warnings, e.g., 5 minutes until cleanup, visual aids, e.g., a timer showing time remaining, and a familiar song or chant provide structure and predictability, helping children mentally prepare and adjust to the change in activity. For example, singing a cleanup song as a cue signals the shift and makes it a fun, predictable routine. Predictable routines reduce anxiety and empower children to manage their own transitions successfully. Question 36. A child is consistently having accidents, wetting pants, even though they were previously fully potty trained at home. The parents express frustration and embarrassment. What is the most appropriate and supportive response from a CDA professional? A. Tell the parents their child isn't truly potty trained and needs to wear diapers again. B. Reassure the parents that regression can happen due to various factors, stress, changes, and discuss ways to support the child without shame, focusing on a calm, consistent approach. C. Publicly remind the child to use the toilet more frequently. D. Suggest that the child is purposefully having accidents for attention. Answer B. Reassure the parents that regression can happen due to various factors, stress, changes, and discuss ways to support the child without shame, focusing on a calm, consistent approach. This question assesses your knowledge of child development, empathy, and ability to build productive relationships with families regarding sensitive issues. The keywords consistently having accidents, previously fully potty trained, and parents express frustration and embarrassment highlight the need for a supportive, non-judgmental approach. Reassuring parents that regression is normal and discussing collaborative strategies, free of shame, helps them feel supported and enables a consistent, positive approach to help the child regain control. For example, you might say, sometimes children regress during times of change or stress. Let's work together to make sure they feel supported here and at home. Always approach developmental challenges with understanding and a focus on supportive solutions. Question 37. You are observing children during free play in the block area. A 5-year-old builds a tall tower, and a 3-year-old child approaches and intentionally knocks it down. The 5-year-old becomes visibly upset. What is the most appropriate CDA intervention? A. Tell the 5-year-old to rebuild their tower and ignore the 3-year-old. B. Punish the 3-year-old immediately without discussion. C. Intervene calmly, acknowledge both children's feelings, help the 3-year-old understand the impact of their actions, and guide them towards making amends. D. Encourage the 5-year-old to hit the 3-year-old back to teach them a lesson. Answer: C. Intervene calmly, acknowledge both children's feelings, help the 3-year-old understand the impact of their actions, and guide them towards making amends. This question tests your ability to guide social-emotional development and mediate conflict in a developmentally appropriate way. The keywords intentionally knocks it down, visibly upset, and most appropriate CDA intervention highlight the need for empathetic mediation and teaching. Intervening calmly, validating feelings, e.g., you look upset because your tower was knocked down, helping the aggressor understand the impact, e.g., he feels sad because his tower broke, and guiding them toward amends, e.g., how can we help rebuild, teaches empathy, problem-solving, and pro-social behavior. This approach focuses on teaching rather than just punishing. Question 38. When setting up a dramatic play area, what is the most effective way to ensure it supports children from diverse cultural backgrounds? A. Provide only costumes and props related to Western holidays. B. Include a variety of props, clothing, and books that reflect the diverse family structures, cultures, and professions represented in your program and the wider community. C. Designate specific days for children from different cultures to use the area. D. Ensure all props are brand new and expensive to show value. Answer: B. Include a variety of props, clothing, and books that reflect the diverse family structures, cultures, and professions represented in your program and the wider community. This question addresses creating an inclusive and culturally responsive learning environment, particularly within a dramatic play area. The keyword most effective way to support children from diverse cultural backgrounds points to authentic and broad representation. Providing a rich variety of props, clothing, and books that reflect the diversity of families and cultures helps all children see themselves reflected in the environment, validates their identities, and promotes understanding and empathy for others. For example, this could mean including cooking utensils from various cuisines, clothing from different cultural celebrations, or dolls with diverse skin tones and abilities. Always strive to make your learning environment a true reflection of the rich diversity of the world. Question 39. You notice that a child in your program frequently avoids fine motor activities, such as drawing or cutting, and struggles with basic self-help skills like buttoning their coat. What is the most appropriate initial action for a CDA professional? A. Force the child to participate in fine motor activities until they improve. B. Tell the parents the child is behind their peers. C. Provide more opportunities for fine motor skill development through engaging play, observe and document specific challenges, and communicate observations with the parents and supervisor. D. Focus solely on gross motor skills, as they are more developed. Answer: C. Provide more opportunities for fine motor skill development through engaging play, observe and document specific challenges, and communicate observations with the parents and supervisor. This question assesses your role in observing development, identifying potential needs, and collaborating with families and colleagues. The keywords frequently avoids fine motor activities, struggles with basic self-help skills, and most appropriate initial action suggest a need for supportive intervention through play and professional collaboration. Providing more engaging opportunities, carefully observing, and documenting allows for a clearer understanding of the child's needs. Communicating these observations with parents and a supervisor facilitates discussion and determines if further intervention, like occupational therapy, is needed. For example, offering Play-Doh, lacing beads, or puzzles during free choice time naturally builds fine motor strength. Always be proactive in supporting development and communicating concerns constructively. Question 40. A new staff member frequently uses baby talk with the 4-year-old children in your classroom, despite your guidance to use clear, age-appropriate language. What is the most effective way for a CDA professional to address this ongoing issue with a colleague? A. Publicly correct the staff member every time they use baby talk. B. Ignore the behavior, as it doesn't seem to harm the children. C. Have a private, supportive conversation with the colleague, explaining the importance of using age-appropriate language for cognitive and language development, and offer specific examples of effective communication. D. Report the staff member to the director without speaking to them first. Answer: C. Have a private, supportive conversation with the colleague, explaining the importance of using age-appropriate language for cognitive and language development, and offer specific examples of effective communication. This question tests your professionalism, communication skills, and ability to mentor colleagues. The keywords frequently uses baby talk, despite your guidance, and most effective way to address this ongoing issue indicate a need for direct, constructive, and educational intervention. A private, supportive conversation allows for a clear explanation of why age-appropriate language is vital, e.g., it supports vocabulary, grammar, and respectful communication, and offering concrete examples helps the colleague understand and implement the change. For example, you might say, using full sentences like, "Please put the red block on top," rather than "woogie woogie blocky," helps children develop clearer language skills. Always prioritize respectful, direct communication with colleagues to ensure best practices. Question 41. Your program's outdoor play space has a small hill. What is the most important safety consideration related to this natural feature? A. Allowing children to slide down the hill on cardboard boxes. B. Ensuring the hill is free of hazards like rocks, roots, or holes, and that the slope is not excessively steep for the age group. C. Covering the hill with brightly colored turf to make it more appealing. D. Restricting children from accessing the hill entirely to prevent falls. Answer: B. Ensuring the hill is free of hazards like rocks, roots, or holes, and that the slope is not excessively steep for the age group. This question addresses safety in natural outdoor play environments. The keywords small hill and most important safety consideration emphasize the need to assess natural features for hidden dangers and ensure they are appropriate for the children's developmental stage. Thoroughly checking for obstacles and ensuring the slope is manageable prevents falls and injuries, allowing children to safely engage in gross motor play like rolling or climbing. For example, before outdoor play, you would walk the hill, looking for loose stones or exposed tree roots. Your primary role is to ensure all play environments, natural or manufactured, are free from preventable hazards. Question 42. You are conducting an observational assessment of a child's social skills during free play. Which behavior provides the most significant evidence of associative play? A. The child plays completely alone, unaware of others. B. The child plays alongside other children, using similar materials, but without direct interaction or shared goals. C. The child shares materials and talks with other children about their play, but without a unified project. D. The child works cooperatively with others on a shared project, such as building a large fort together. Answer: C. The child shares materials and talks with other children about their play, but without a unified project. This question tests your knowledge of the stages of social play, Parton's stages, specifically associative play. The keyword most significant evidence of associative play requires you to differentiate between parallel play and cooperative play. Associative play is characterized by children playing alongside each other, sharing materials, and communicating about their play, but they are not yet fully coordinating their efforts towards a single, shared goal. For example, two children might be building separate block towers but sharing the same box of blocks and talking about their individual creations. Understanding these stages helps you observe and support social development appropriately. Question 43. A toddler frequently throws toys during free play. After consistent redirection and offering alternatives, the behavior persists. What is the most appropriate next step for a CDA professional to take in addressing this? A. Remove all throwable toys from the classroom permanently. B. Implement a clear consequence immediately each time the toy is thrown, such as briefly removing the child from the activity or the toy, with consistent follow-through. C. Tell the child's parents that their child is bad and needs to be disciplined at home. D. Ignore the behavior, as toddlers often throw things. Answer: B. Implement a clear consequence immediately each time the toy is thrown, such as briefly removing the child from the activity or the toy, with consistent follow-through. This question addresses behavior guidance for toddlers, specifically for persistent challenging behaviors. The keywords frequently throws toys, persists, and most appropriate next step indicate a need for consistent, immediate, and understandable consequences. Implementing clear, logical consequences, like briefly removing the child from the activity or removing the toy, helps the toddler connect their action to the outcome, teaching them appropriate boundaries and self-regulation. For example, you might calmly say, "Blocks are for building, not for throwing. When you throw them, they go away," and then remove the block for a short time. Consistency is key to helping young children learn about expectations and consequences. Question 44. You are planning to introduce a new food, lentil soup, to the children during lunch. Some children have never seen or tasted lentils before. What is the most effective approach to encourage acceptance and enjoyment of this new food? A. Require each child to eat at least 3 spoonfuls of the soup. B. Serve a small, no-pressure portion of the lentil soup alongside familiar foods, and offer positive comments about its appearance and smell. C. Disguise the lentil soup by blending it into a more familiar food. D. Tell children they won't get dessert unless they try the new soup. Answer: B. Serve a small, no-pressure portion of the lentil soup alongside familiar foods, and offer positive comments about its appearance and smell. This question tests your knowledge of best practices for introducing new foods and promoting healthy eating habits. The keywords new food, encourage acceptance and enjoyment, and most effective approach highlight the importance of positive, pressure-free exposure. Offering a small portion alongside familiar items reduces anxiety, while positive comments encourage curiosity without coercion. For example, you might say, "Look at this delicious lentil soup. It smells so warm and yummy," as you serve it. Children are more likely to try new foods when they feel safe and unpressured, and repeated exposure often leads to acceptance. Question 45. A parent informs you that their child will be celebrating a religious holiday that is unfamiliar to you and most of the children in the program. What is the most appropriate and respectful way for a CDA professional to respond and support the child and family? A. Ignore the information, as it is not part of the standard curriculum. B. Research the holiday to learn about its customs, and if appropriate, integrate some respectful, educational elements into the program with the family's input. C. Tell the family that religious celebrations are not allowed in the program. D. Ask the child to explain their holiday to the entire group during circle time. Answer B. Research the holiday to learn about its customs, and if appropriate, integrate some respectful, educational elements into the program with the family's input. This question addresses cultural competence and building productive relationships with families. The keywords religious holiday that is unfamiliar and most appropriate and respectful way emphasize the need for thoughtful, informed, and collaborative inclusion. Researching the holiday and then consulting with the family to integrate appropriate, respectful elements demonstrates genuine interest and validates the child's identity, enriching the learning environment for everyone. For example, you might ask the family if they would like to share a book or a song related to the holiday, or teach the group a simple greeting. Embracing and learning about diverse cultures enriches the entire learning community. Question 46. What is the primary purpose of a CDA professional conducting daily health checks upon children's arrival? A. To determine if children have brought their lunch boxes. B. To ensure all children are wearing appropriate clothing for the weather. C. To identify any signs of illness, injury, or neglect that may require immediate attention or follow-up. D. To confirm the child's attendance for billing purposes. Answer C. To identify any signs of illness, injury, or neglect that may require immediate attention or follow-up. This question tests your understanding of routine health and safety protocols. The keywords primary purpose and daily health checks highlight the most critical reason for this daily routine. Daily health checks are essential for safeguarding children's well-being by allowing you to observe for visible signs of illness, e.g., fever, rash, injuries, e.g., new bruises, limping, or potential neglect concerns, e.g., hygiene issues, extreme fatigue. For example, a quick visual scan and a friendly greeting can reveal a child who is unusually pale or has a cough. This proactive measure ensures timely intervention and helps prevent the spread of illness. Question 47. You observe a 5-year-old child struggling to recognize several letters of the alphabet, despite consistent exposure in group activities. What is the most developmentally appropriate intervention for a CDA professional? A. Tell the child they need to try harder to learn their letters. B. Provide individualized, playful practice opportunities focusing on the specific letters the child is struggling with, using multisensory approaches. C. Send a note home advising parents to hire a tutor for the child. D. Move on to teaching numbers, as the child isn't ready for letters. Answer B. Provide individualized, playful practice opportunities focusing on the specific letters the child is struggling with, using multisensory approaches. This question assesses your ability to apply individualized instruction for advancing intellectual competence, specifically in early literacy. The keywords struggling to recognize several letters and most developmentally appropriate intervention indicate a need for targeted, engaging support. Providing individualized, multisensory practice, e.g., forming letters in sand, tracing them with fingers, singing letter songs, addresses the child's specific learning needs in a fun way, building foundational literacy skills. For example, if a child struggles with B, you might have them build the letter with Play-Doh or find all the B's in a book. Tailoring instruction to individual needs helps all children succeed at their own pace. Question 48. When choosing books for the classroom library, what is the most important factor for a CDA professional to consider to promote a positive self-concept and diverse perspectives among children? A. Selecting only popular books that have won awards. B. Including books that exclusively feature characters from the dominant culture. C. Ensuring the collection reflects diverse family structures, cultures, abilities, and experiences, allowing all children to see themselves and others represented. D. Prioritizing books that are heavily text-based to challenge early readers. Answer: C. Ensuring the collection reflects diverse family structures, cultures, abilities, and experiences, allowing all children to see themselves and others represented. This question addresses the critical role of books in promoting social-emotional development and cultural responsiveness. The keywords most important factor, positive self-concept, and diverse perspectives highlight the need for inclusive representation. A diverse book collection allows children to see their own experiences validated, fosters empathy for others, and broadens their understanding of the world, directly contributing to their self-esteem and respect for differences. For example, if you have a child with two moms, include books with diverse family structures. Books are powerful tools for building identity and understanding, so make sure your library is a mirror and a window for all children. Question 49. A parent regularly drops off their child visibly upset and crying, and this causes disruption for the child and the group. What is the most effective routine for a CDA professional to suggest to the parent to ease separation anxiety? A. Advise the parent to sneak out when the child is distracted. B. Encourage a quick, consistent goodbye ritual and assure the parent that the child will be comforted after they leave. C. Tell the parent to stay longer until the child is completely happy. D. Suggest that the child stay home until they are no longer upset about leaving. Answer: B. Encourage a quick, consistent goodbye ritual and assure the parent that the child will be comforted after they leave. This question tests your ability to support social-emotional development during transitions and collaborate with families. The keywords regularly drops off their child visibly upset and most effective routine indicate a need for a predictable and reassuring strategy. A quick, consistent goodbye ritual, like a special wave or kiss, provides closure for the child, while the assurance that the child will be comforted helps the parent feel confident in leaving, fostering trust and a smoother transition for everyone. For example, you might suggest, let's try one quick hug, a high five, and then you wave from the door, knowing I'll be here to give them a cuddle right after you leave. Consistency and reassurance are key to easing separation anxiety. Question 50. During circle time, a child continually interrupts by telling unrelated stories. You have gently reminded them about turn-taking several times. What is the most appropriate next step to manage this behavior while still valuing the child's contributions? A. Tell the child they are not allowed to talk anymore. B. Give the child a specific time to share their story later in the day, acknowledging their eagerness to share while maintaining circle time focus. C. Ignore the child's interruptions completely. D. Send the child to time out for interrupting. Answer: B. Give the child a specific time to share their story later in the day, acknowledging their eagerness to share while maintaining circle time focus. This question assesses your ability to manage group dynamics while supporting a child's social-emotional development and communication. The keywords continually interrupts, unrelated stories, gently reminded, and most appropriate next step while still valuing the child's contributions highlight the need for a balanced approach. Acknowledging the child's desire to share but deferring it to a more appropriate time, e.g., during free play or individual chat time, validates their voice without derailing the group activity, teaching turn-taking and self-regulation. For example, you might say, "That sounds like a wonderful story. Let's save it for during playtime, and you can tell me all about it then." This teaches children appropriate times for sharing while respecting their thoughts and experiences.